Assalamu alaikum. Today we're going to talk about vaginal bleeding in early pregnancy. So, ليرة أجر أما vaginal bleeding منهبو early pregnancy. What are the differential diagnoses? First, miscarriage. Second, ectopic pregnancy. Third, molar pregnancy. Or it could be because of local gynecological lesions. We will have a video about ectopic and molar pregnancy. And in this lecture, we're going to focus on the miscarriage. So let's go to our topic. So differential diagnosis again. I told you, yan miscarriage, or it's ectopic pregnancy, or it's molar pregnancy. So first of all, let's see how can we differentiate between these three based on the history and examination and also ultrasound. So, the miscarriage in history, the lady will tell you that she has passed blood or maybe tissue or clots, and they have had previous history of miscarriages. And in examination, the abdomen is soft, and we can assess the cervical os. The cervical os, it could be open or closed. If it is open, then that's highly suggestive of miscarriage. And also we can do ultrasound. Ultrasound, we will see an intrauterine fetus in the baby and beta SCG to confirm the pregnancy. That's how we know if a woman is having miscarriage. They complain mostly of bleeding. In ectopic pregnancy, the history, what's important is they will have bleeding, but it's mostly spotting. It's not as much as in miscarriage. However, in ectopic pregnancy, again, ask if they have had previous history of ectopic pregnancies, and also they will have, on examination, abdominal pain and tenderness. Because of peritoneal irritation, aga rupture bubi especially, and aga cervical, speculum examination or digital examination, there will be cervical excitation, which is also suggestive of ectopic pregnancy. La ultrasound, what do we see in ectopic pregnancy? We see empty uterine cavity. كبتا beta HCG دنيرين دبينين it's high, so that means it's most likely ectopic pregnancy. Molar pregnancy, what can we ask in history if they have past vesicles? Vesicles are these small fluid-filled structures. They have passed this vesicle, or they may be presented with bleeding as well. And on examination, or again previous history of molar pregnancy أول زور مهمة ببرسين. On examination, تمشادك uterus, especially if it's if it's complete form, the uterus is larger than usual, and beta HCG is markedly elevated. And on ultrasound, you will see snowstorm appearance, and also you can see theca lucent cyst. And based on these 3 points, you can tell if it's molar pregnancy or ectopic pregnancy or miscarriages. So esta zater di qaddadina sar miscarriage. In miscarriage, what is it? It's the spontaneous loss of pregnancy before the fetus reaches viability, which is when it's from the time of conception until 24 weeks of gestation. So the time of conception until 24 weeks, any lady, if they lose their baby, then that's miscarriage. Depending on the WHO definition, it's expulsion of a fetus or an embryo weighing 500 grams or less. دكتورة قلتي زور قناعتي بو definitioninات كده expulsion of a fetus, بس أما design miscarriage we have missed miscarriages كدارة expulsion fetus كينبا قلتي this definition is better to depend on. So coming to the types of miscarriage, ليرة استدلتي بلكي باسي أون دي دكين أو دوش دوا دين باسي دكين in detail بس induced abortion هيا induced abortion it could be because of legal reason or illegal reason illegal reason كبخوان لو أنا اشتكي introduced كان لبخوان حتى like metals or something to induce abortion or legally because there is danger to the mother so we have to terminate this pregnancy otherwise we will lose the mother or if the baby has a condition that is incompatible with life, we will induce abortion. So let's talk about the types of miscarriages. First, we have threatened miscarriage. In threatened miscarriage, let's come to the clinical presentation. There will be vaginal bleeding, but mild vaginal bleeding. There will be abdominal pain, but mild abdominal pain. And if we go look at the os is closed. So this is a pregnancy that can be saved. It can resolve on its own. This doesn't mean that it will end in miscarriage for sure. يعني لو أنا بخوي threatened miscarriage bleeding ببيني أما تبي كوزكي أو bleeding ببيني no أجا كوزكي ما عندي تو treatment كر it will have a viable pregnancy بمشكلة دبي. الألتراساوند تدابينين you will see an intrauterine pregnancy with fetal heart rate positive. This is in threatened miscarriage. مهمة كيتيا fetal heart rate positive with cervical OC closed and the management is only supportive. You don't do anything. Inevitable miscarriage vaginal bleeding and abdominal pain but it's more severe than the threatened miscarriage. And in speculum examination, the cervical os is open. This is the difference between these two. Later it's closed, later it's open. So this one 100% will end in miscarriage, either incomplete or complete miscarriage. But later no, maybe not. Like maybe the condition will resolve تكيهش cervical os closed بس later نقع and the bleeding and the pain is more severe than this one as well our two difference أجابين ultrasound what is the difference عين later there's intrauterine pregnancy but there's no fetal heart rate babyaka it's dead so later management يتيا expectant you wait maybe بخوي لو أنا expulsion fetus كيبكا without any help or medical treatment كدوها بازدكي medical treatment كانسيا or surgical if medical treatment failed or if we have to go to surgical immediately. Then we have incomplete miscarriage. The incomplete miscarriage there will be vaginal bleeding and abdominal pain as well. ليرش abdominal pain is severe بس فرقكيتيا in vaginal bleeding there will be passage of tissue maybe it's product of conceptions and there will be passage of clots. Later there's no passage of tissue. Later there's no passage of tissue. But later there is passage of tissue. And also the speculum cervical os is open. Whichy awaya? Awash opena. But later handek product of conception located in the cervical os debiniawa. But later no, you don't see any product of conception. And بينسر ultrasound you will see retained product of conception هموي نروشتيا بس هندشي ما يتوا هندشي as tissue expulsion كرايا management away remove pregnancy tissue كيبكا which examination تكر لكن cervical os tissue did remove it if possible and expectant عينن which wait صورك maybe بخوي أو incomplete لباشما which دبتا complete or medical and surgical treatment. Then we have complete miscarriage. The complete miscarriage تماندبي pain, bleeding, but it has been resolved. يعني the lady will come to you هيت عيبينيا دلي أتو سحاليا جانتها دلنا خين دبيني دلنا وأجت مشاي cervical ossipkin it's closed. Okay, so later ultrasound دنيرين بزانين أو مشكلة أو bleeding و pain تبوا أجر empty uterus mandate then دلين أو it's complete miscarriage. لو أنا دلي مثلا لبليدينجا كدلين tissue دي دلي yes clot دي دلي yes so دلين this is complete miscarriage. However serum HCG باهر بكين to exclude ectopic pregnancy. تكيما design ectopic pregnancy you will see an empty uterus maybe our ectopic pregnancy be so there be HCG monitor بكين أجر هيت previous ultrasound كمان نبوك confirming intrauterine pregnancy بكا. The complete miscarriage it's only supportive you don't do anything. And in missed miscarriage ليرا the lady لبو normal follow up ultrasound هاتيا and then in the ultrasound تمشادا كان there's no fetal heart rate and the baby is dead and these ladies they're asymptomatic again لنبو يعني هيت أو symptomانيا نبو هتا بزانن ك they've underwent a miscarriage and fetal heart rate is negative and intrauterine pregnancy دبيني. And this one again expectant maybe بخوي expulsion دكا or medical or surgical. So ليرا مهمة كان cervical ossa كان بتزواني بخينن and also the bleeding is it associated with tissue and clots yes or not and fetal heart rate كان كتسدبينين لألtrasound is very important. And then ليرة دلة inevitable and incomplete miscarriage inevitable goat man ليرة there's no way out of it تاو fetal heart rate is negative incomplete كgoat man أو there's some retained tissue در لي فرق كيتيا هردوشان there's an open cervical os بس the whole ليرة inevitable the whole conceptus is still inside the uterus. زارهيت اشتاقوشي tissue درنتو cervical osi. بس the incomplete miscarriage, parts of it is inside and parts of it is outside, associated with passage of fetal tissue. So later, there's passage of fetal tissue. Later, nah, there is not. And they also have the same management. Why a miscarriage happens? First of all, the most common reason is because of chromosomal abnormalities or other developmental abnormalities, maybe cardiac malformation, because of a lot of reasons, the baby is not developing well. Or because of medical and endocrine disorders, of the mother hypothyroidism or diabetes mellitus hypertension on hormonistic factor or uterine abnormalities. It could be congenital or acquired. Congenital مثلا septemi أو recurrent miscarriage if not diagnosed. Acquired like fibroids or any abnormalities of the uterus لو تشي recurrent miscarriage بكا. Infection and drugs and chemicals which are teratogenic. So, later, what issues in history support the diagnosis? Possibility of ectopic pregnancy must be considered in any case with vaginal spotting or lower abdominal pain. Gotman kada persin ectopic pregnancy, previous ectopic pregnancy, habwayana, abdominal tenderness hayana, ultrasound ushtida kain, and degree of bleeding is important. Lega passage of product of conception, kepemandelet type miscarriage, whether slight or large containing clot pieces or not, which occur in incomplete or complete. If containing vesicle kabasumkir or it's molar pregnancy, a passage of vesicle habu. The bright blood is more in threatened abortion, while dark color blood in missed abortion. Agar rangaka sura shifata habu wa mild bu our zor suggestive of threatened abortion. So, clinical examinations that can, first of all, vital sign to ensure the vital sign of the mother. Temperature, a high temperature, and it indicates septic miscarriages. كدين بازدكين. Blood pressure, either it's elevated or depressed. depressed ذاتر لا hemodynamically unstable patient. If it's elevated, then that's suggestive of molar pregnancy. تكي قلت مال molar pregnancy preeclampsia زود تجدبي before 20 weeks of gestation. So they will be presented with an elevated blood pressure. And pulse rate. If the patient is tachycardic, then that's hemodynamically unstable patient. Two possibilities man here. It's severe bleeding as an incomplete miscarriage or ectopic pregnancy, especially ruptured ectopic pregnancy. The abdominal examination, again, rebound tenderness and acute abdomen manhabu, it's ectopic. Why? Because of peritoneal irritation, which acute abdomen debi or rebound tenderness man debi. But if it's soft and non-tender abdomen with no palpable mass, أو ذات legal miscarriage darwa. Vaginal examination لودا كين يكمشت لبو visualization of the cervical os بزانين if it's open or closed, and also بزانين fetal tissue present or not present. كقولتمان fetal tissue is present in incomplete miscarriages. And also to exclude local causes. لو عناها, it's because of cervicitis, كتوشي أو bleeding bubi, or ectropion, which is what? It's, I think, ectropy, the endocervix will extend into the ectocervix, and we know the endocervix is very liable for bleeding. So أوانا توشي post-coital bleeding الدكن, like after sexual intercourse, they will experience bleeding. Or cervical polyp, it could be a polyp causing this bleeding, or a cervical mass, carcinoma, or dysplasia, although rare, should not be missed. So vaginal examination ده كان عندك زلوني أو bleeding أصلا علاقة ب pregnancy أو كون نبي because of these local causes. In the os or the vagina, cervical os, open or closed on digital examination, will help to distinguish between the different types of miscarriages. Then we have bimanual examination. Uterine size should be assessed. I told you it will be elevated in molar pregnancy, especially complete. Uterine tenderness is unlikely unless there is septic abortion. There will be uterine tenderness. There's infection going on in the uterus, but no, there's no infection. Vaginal examination may elicit cervical excitation كأول ectopic pregnancy رودة. And then we have what? What investigation would be most helpful and why? First of all, the urine beta HCG is more reliable than home pregnancy test. Of course, laboratory باشترى لو يكلا home pregnancy test دكي were more superior to the urine. It's the one which is done in the blood. So the most superior it's the blood. بس ليه دليل يعني the urine beta HCG زيادة reliable لو home pregnancy يعني كده كان where they urinate on a stick and then خطا كان دو خط ديار دبي. Then we do full blood count. Why? Because to know again if there's severe bleeding, anemia, then we should consider blood transfusion. For leukocytosis and septic miscarriages or septic abortion, there will be leukocytosis. We look at the platelet for a complication which is called DIC. حتى أو complication avoid بكين دي بتمشي platelet number بكين. Blood group and RH حتى بزاين أجا مذركة RH negative B حتى anti D بدينا. And blood group حتى أجر anemic بو RBC حازر كين like لبو blood transfusion يدبي بزانين cross match بكين in the case of shock. ليرة دلا لا transabdominal ultrasound to transvaginal ultrasound, a single ultrasound can diagnose a miscarriage if there is a pregnancy within the uterine cavity. There are certain criteria that are met كدلين أو ليديا بألتراساوند the time بلين she has underwent a miscarriage. What are the criteria? ولو lecture ultrasound man حتى نخين ديا بس I'll try to make it easy. دلة if the crown rump length. What's the crown rump length? It's a longitudinal axis from the head of the baby measured until the buttocks. Okay, so if this length is 7 millimeters or more but transvaginal ultrasound usually أجر أو length جيشتا 70 تبي أما جمان لتبي لفيتال heart rate تبي بس أجر لألتراساوند دي تمان أو length معناها when there is no visible heartbeat then the lane this is a miscarriage, the baby is dead. Our method number 1 by using the crown rump length كده بي 7B ك7 بده بي fetal heartbeat heavy أجر نبي then that's abnormal. دلا if the mean gestational sac diameter. Gestational sac تيا it's a fluid-filled sac. It's the first sign of pregnancy which is seen on ultrasound. يعني يكم شد I think if I'm not mistaken the 4 weeks of gestation دبينين يكم sign the pregnancy كببينين it's this gestational sac diameter. I'm not sure, we have not studied ultrasound in pregnancy بس on the surgeon كرد بي أو هنسرابو so دل أجر أو ساكا is greater than 25 millimeters, okay, but transvaginal أوانا هموي دبي fetal pole هبي كجيشتا أو lengthy. fetal pole تيا أو first sign embryoya كلا أوي دبينين ultrasound دبينين I think لا 6 to 7 weeks it will be visualized or something like that. So دلا أجر gestational sac diameter كبخوي قوتم ل 4 weeks ديار دبي أو صبر جورة دبي وشي جورة بو جيش 25 في دبي أو اختي fetal pole man ديار بي أجر fetal pole man ديار نبي أوش يعني miscarriage هيا. So أو دو scenario man هيا crown rump length جيش 70 no fetal heartbeat أو miscarriage. Gestational sac جيش 25 في no visible fetal pole أوش it's miscarriage. In both scenarios, a second opinion should be considered. يعنيش you should wait for 7 days أو زدوا ديسان examination كي بكوا ultrasound بزاني أين finding دبينيو يانا. And then later دله هندك زار the serum beta HCG if it's below the threshold level for sonographic visualization. دلا مثلا أما دبي بيتا HCG بقاتا رقمك محدود حتى أما بطانين لألتراساوند دي أو شتاني ببينين you know بس أجر نجيشت بيتا أو رقمك دبي لهزارو بنصد زياتر بي أو دال لترانسفاجينال ultrasound دطانين بلين there is a pregnancy ودبي لسه هزار زياتر بي لبو trans-abdominal ultrasound. So يعني أجا ليديا كانت بتا HCG بابلين هزار بي استفادي هي أجا transvaginal ultrasound بكان نوتكي أما ناتانين detect بكين ناتوانين visualize بيبيا كي بكين so أجر يعنيش بيبيا كانت ليديا كانت عفوا بتا HCG 2500 بي أتونابي بتي abdominal trans-abdominal ultrasound لوب كي سكي أما دبي 3000 بي أوزل abdominal ultrasound دبي transvaginal ultrasound لوب كين so دلان تبكين أدي أجر لو رقمانا قد كتربو كم تربو then the beta HCG should be repeated after 48 hours لباش دو روجي دوباره دكينوا نمبركا it should be double its size تمام أجر ديتمان بتا HCG هزار بو دو روجي دي كرد معناوا دبي ببتان 2000 بس أجر ديتمان decrease كرد بو أو it's miscarriage أجر ديتمان slowly it's rising أو it's suggestive of ectopic or أجر ديتمان it's like neck double, triple بوا مثلا لها زارة وبويتا 6,000. That's a lot. Then that's suggestive of molar pregnancy. ليرة دلا ultrasound fetusaka intraia or extrauterine. Again, extrauterine B, that's ectopic pregnancy. Is it viable or not by depending on the fetal heart rate? Retained product of conception دبيني لا incomplete partsك مايتوا يعني لا بيبيك همي نهاتي تدرى. If pregnancy test is positive, whether is an empty cavity كتازة باسمكر قطمان yan it's complete miscarriage or ectopic pregnancy. Any tissue expelled from the uterus دبيلا بو histology بنيرين. Why? To exclude molar pregnancy. سكي molar pregnancy دكتور أفين قوتي بهistology diagnose definite diagnose ذكره. There is sometimes the tissue is endometrial cast without any trophoblast indicating an ectopic pregnancy. يكم شد أوتسيا an endometrial cast it's the shedding of the uterus lining يعني كلوتشي جورة دبيني ليديكا it's the shedding of the entire uterus lining. Well, there's a lot of reason why this could happen. Because of hormonal imbalance رجعت مشادكا there will be a passage of like a very large clot yes, it's a piece of like tissue. It's the uterus lining. أو ذا لانه يكك أو شتا أو endometrial casta لقى miscarriage ليتك بتسيب oh did I just lose my baby or was I pregnant and I lost my baby تسدكين أو يدبينا histology لهistology تمشي trophoblast دكين we know trophoblast يكمش trophoblast دكيا and then like placenta يدروز دكا هم لبو baby يكي يدروز دكا أجا trophoblast تدابو then yeah أو miscarriage بوا. If not, then no, this is endometrial cast يعني أو نا placenta تدايا نا trophoblast cell تدايا إلى قينية pregnancy وهندك تار ectopic pregnancy ودكا endometrial cast تهبي. Okay. Dinosaur treatment options. According to the condition and most probable diagnosis, Gutmann threatened it's only reassurance, there is no need for admission and follow-up. If bleeding ceased, no need for progesterone, bed rest to avoidance of sexual intercourse. It's what? It is supportive. And then in missed, تصدقين يكم shit expectant, we wait and see. Maybe بخوي expulsion دكا without using any help. Or medical yan orally prostaglandin orally can misoprostol or vaginally. Legal we have mifepristone ka labo termination in pregnancy debi awish. It's a progesterone antagonist. These are the two medical treatment that we can give. Or surgical evacuation of the retained product of conception. Yamba kurtazi dekre yanish Dr. Evin Ewidzare I think basi balloon dilatation yekir ba Foley catheter where they insert a Foley catheter or the balloon ke inflate dekan or the shtachi qoris lesser catheter ke dadanen belady ke dela walk a bit or the which catheter ke derdatsi there will be complete miscarriage yani again incomplete be. You should read about it. It's actually very interesting. And then we have septic miscarriage. The septic miscarriage usually awanea ka illegal abortion إذا كان كبخوان they will induce a metal yan something حتى أو pregnancy نمينة. So it's any miscarriage associated شرط شنو لو أنا هر miscarriage بي associated with clinical evidence of infection which is fevers and chills وزورشتي دي استباز دكين. So قطمان uterusaka tender دبي أليرا. Clinical feature كانت pelvic and lower abdominal pain and uterine tenderness, and purulent vaginal discharge and vaginal bleeding. There's an infection going on. Of course, there will be bleeding, there will be discharge and tenderness of the whole area and pain. On examination, there will be a rise in the temperature, or there's like a depression in the temperature. There will be tachycardia, tachypnea, and hypotension if hemodynamically unstable be. And the cervix feels soft with an open os. Investigation again, full blood count, labo RBC denerim sanin anemia or not, is she anemic or not, do we need blood transfusion or not, leukocytosis, platelet, and also blood group حتى بزي for like RH أو لabo anti-D, giving anti-D, blood group for blood transfusion, and cross match أول شهر لabo blood transfusion, blood culture بكا حتى بزانين what infection, like what is the causative agent حتى أما بتانين antibiotic بدينك the bacteria is not resistant to the antibiotic, and swabak بكين وبينيرين لabo culture again, and renal function test and liver function test, because we know لو أنا تشي septic shock be septic shock there will be low organ perfusion. Low organ perfusion there will be organ damage. So أما دبي بزانين LFT و RFT renally بتزواني إيش دكا livery بتزواني إيش دكا تشي renal failure بوا or تشي liver failure بوا يانا. Coagulation profile لبو DIC دبي check كينوا. CRP it's markedly elevated la septic miscarriage, and serum lactate أوش لبو identifying septic shock la septic shock serum lactate I think more than 2 something which is لدو then that's suggestive of septic shock. Ultrasound بكين and plain x-ray بكين. So can look because of foreign bodies, but foreign body with CT and termination pregnancy كام بكين تبي x-ray بكين بزين foreign body هي لنا uterus يعني. Treatment كي intravenous fluid to شي hypotension دبن. That's why we should optimize blood flow for the organs, and IV broad spectrum antibiotics, and evacuation and continue antibiotics for at least 5 to 7 days. Then we have recurrent miscarriage. What is recurrent miscarriage? It's defined as the loss of 3 or more consecutive pregnancy. يعني يكتب بلا أمن استا I've underwent a miscarriage وبيشانيش دود زار I've underwent a miscarriage أتوبة برسبلة أو دود زارة يعني همي لسر يكبو يانش لو بيني حملة كرد لنا لو بيني حملة كم كردا then that's not recurrent miscarriage. Recurrent literally دبي همي one by one after another همي تشبي ببي away hits viable pregnancy لو بيني heavy. What are the risk factors? Advancing maternal and paternal age, because the sperm and the egg quality خراب دبي. Obesity, because it's associated with comorbidity and a lot of diseases like diabetes, hypertension كأوانا. It's bad for pregnancy. Balanced chromosomal translocation, and later there is no gene deletion, best there will be translocation أوديت إيرا زي كان يندقورة توا. Or it could be because of uterine structural anomalies بس يمكن لسرة قلتم structural man هيا, or congenital structural na I meant acquired. We have acquired and also congenital septemi heavy acquired because of so many reasons like fibroids, uterine cancer, you name it. Later we have antiphospholipid syndrome. Antiphospholipid syndrome it's an antibody against the phospholipid. Outcome أو syndrome بكرتو مختصري it's thrombosis. So أو thrombosis, it's bad for pregnancy because it causes placental thrombosis. So أوا تشي thrombosis و clots دكا أو clots ديت إيرا تشي placental thrombosis and then there will be miscarriage. So investigation كانت testing for antiphospholipid antibodies بزانين أو نخوشي هيا imaging of the uterus بزانين congenital or acquired problem هيا products of conception in subsequent miscarriages are sent for cytogenic analysis. يعني وجي تبعد لك دنيري دلي لو أو مردية أو بيبيا what's the reason of it هتا بزانين كوزاكيتسي و treaty بكين. Management aspirin and low dose of heparin لبو reduction of miscarriage أو anti-phospholipid syndrome يعني هنا سكي قوتم anti-phospholipid there will be clot and thrombus formation. So أما كو أوي avoid booking by giving heparin and aspirin. Balanced translocation may be overcome by pre-implantation genetic diagnosis or gamete donation. يعني sperm و egg لديك receive دكان يعني ذكرناه يعنيش با IVF سكي IVF دتاني أتو أو fertilized ovum testi لبابكي أجديت genetically تانية you're not gonna implant it. So by IVF the tiny reduce risky balance translocation بكينوتسكي already we will not introduce an ovum ka أو مشكلة heavy. Congenital uterine abnormalities كuterine septum بي and cervical incompetence بي لو أنا it's consider surgery and لبوبكين كأو مشكلة نتساكينا. Most couples have normal investigation and psychological support and serial ultrasound scans during pregnancy are beneficial. هندك تعرف it's مشكلينيا بس هرتوشي miscarriage دبي. So later patients who have suffered miscarriages are counseled to ensure that they understand that most miscarriages are non-recurrent and they do not blame for their loss. Khatay mother kenya. They should be provided with necessary psychological support. Kalera oshtania. Vaginal bleeding in pregnancy is associated with miscarriage in up to 15% of the cases, but the risk is lower if the bleeding is light. Zorbi miscarriage can bleeding yanha. After a fetal heartbeat has been visualized, the chance of miscarriage is 5%. كم تردبتو chance miscarriage كي وقت دبتو threaten miscarriage and قلتم threaten miscarriage شرطنية it ends into a complete miscarriage لو أنا resolve be. Early in the course of normal intrauterine pregnancy, the beta HCG should rise at least 66% over 48 hours. Good man to be double B. Kalera 66. So not double. I give a percentage وستين أو there be 66% لباش بتصير ساعات أو زياد بكام. And thank you.